Hey everyone, this is Dr. J with Twin City Health, and today I just wanted to talk to you about chiropractic care while you're pregnant. There are many different reasons why mom might come in to get adjusted through her pregnancy. Most of it being because as she gets bigger, her body starts to change, which means more pressure on certain areas of her spine, certain muscles. So a lot of moms might experience low back pain, sciatica, especially as the baby grows and is moving around and change positions. They can also experience reflux, headaches, just a number of different issues that may or may not be related to your pregnancy. So this is why we get a lot of moms adjusted. But really what we're also excited for with our moms and what we can help with is fetal positioning. And so first, let's run through a few different fetal positions that probably are not optimal to having a natural labor or birth. We're going to go with the posterior positioning, where the baby is also known as sunny side up, so it's facing outward. Again, that's just not a good position for a natural birth. We'll also have transverse, where the baby is just side lying. There is an oblique, which is between side lying and completely head down. And then breech. There's actually a couple different forms of the breech position, but breech position is either the baby's butt is down and his feet, both legs are completely up, which is the frank breech. You also have the middle one where one foot is down, and then a complete breech where both babies' knees are pulled in, butt is down. Again, just not optimal positioning for the baby. And then we have the occiput anterior, which is going to be the best position that you want the baby to be in, which is head down, in order to have a natural vaginal delivery. So this is what we're looking for. And typically somewhere around 26, 28 weeks is when the baby is going to go head down. And if it's getting to be 30 weeks, 32 weeks, and the baby's still not head down, that is definitely when you'll want to start to do some sort of intervention to really help make sure that the baby gets down into that natural position. One of the things that people can do is chiropractic care. And how that can help is because chiropractic care, we use a gentle technique called Webster's, and it's not a magic trick or anything like that. Like, we don't actually force the baby into position. It actually just allows us to open up your hips, your pelvis, your SI joints, to create more room essentially in your hips and your uterus, and less intrauterine constraint, so that the baby can actually move and flip him or herself down into that position. And so some of the ligaments, as chiropractors get to work on to help with this intrauterine constraint, number one is the sacrotuberous ligament, or this ligament back here, which is also going to be right here in your hips and your low back. Just releasing those ligaments will help with your SI joints so that your hips can move a little bit easier, and that tailbone can rock in and out. Another ligament is called your round ligament. So a lot of moms might experience round ligament pain through their pregnancy, or they might feel like some tension or tightness when they cough or sneeze or anything like that. But loosening up the round ligaments, which actually attaches to your uterus, can release some of the intrauterine constraint. Again, allowing the baby to actually move and have enough room to get him or herself face down. And then the last thing that we'll look at as a chiropractor to help with fetal positioning is a muscle called your psoas. So your psoas runs from your lumbar vertebrae down through the hip, around the uterus, into your leg. And so if that muscle is tight, again, it can cause some constraint. It can actually throw your hips off as well and cause low back pain. So releasing that muscle will actually help, again, with fetal positioning. So the best thing that you can do to help with fetal positioning is the Webster's technique, which we do here at the office to help the baby get into a natural head down position to help with that labor and delivery. Hopefully it will allow for a shorter, quicker, easier labor time. Thanks for joining us, and we'll see you next time.